When people search for migraine medications, what they really want to know is, what do doctors actually prescribe for migraine? And that's where things get confusing, because a medicine that is popular for a regular headache is not always the same thing doctors prescribe for migraine. This list is based on American medical reports and migraine treatment guidelines from recent years, along with the broader neurological understanding of headache disorders, shaped over decades by specialists like Dr. Oliver Sacks, who helped people understand just how complex and misunderstood migraine really is. So in this video, we're going to break down 10 of the most commonly prescribed and most commonly recognized migraine-related medications in the US. Not to tell you what to take, but to explain why doctors choose different medications for different patients. This video is for educational purposes only and is not a substitute for medical advice. And before we start, if you like clear science-based videos about headaches and migraine, give this video a like and subscribe to Headache Relief Lab. Because the first medication on this list is one almost everyone in America already knows, and that's exactly why we need to talk about it first. Let's start with the one almost everyone in America already knows, Tylenol, or more specifically, acetaminophen. This is one of the most common medications people reach for when they have a headache, and that's exactly why it has to be first on this list. Because Tylenol is incredibly familiar, incredibly accessible, and for a lot of people, it's the first thing they try before they ever talk to a doctor. And to be clear, acetaminophen is not some random choice. Major US medical sources do include it among common pain relief options that may be used for some migraine attacks, especially milder ones. But here's the key difference. Tylenol is a general pain reliever. It is not a migraine-specific medication, and that matters. Because migraine is not just a bad headache, it's a neurological event. That's one of the biggest ideas neurologists like Oliver Sacks helped bring into public understanding. Migraine isn't simply pain, it's a much more complex brain process. So a medication that helps with ordinary headache pain may not be enough when the problem is an actual migraine attack. That's why doctors may still mention acetaminophen, but they often don't stop there. If someone's attacks are stronger, more disabling, more frequent, or come with things like nausea, light sensitivity, or that classic pounding migraine pain, doctors often start considering medications that are more targeted to migraine itself. In other words, Tylenol may be where many patients begin, but it's often not where migraine treatment ends. There's another reason this chapter matters. A lot of people keep taking common headache medicine again and again because they assume, if the pain is still here, I just need more pain relief. But migraine specialists warn that frequent use of acute pain medications can become its own problem over time, contributing to medication overuse headache. So even a very familiar medicine can become part of the wrong strategy if it's being used too often. So the reason doctors may bring up acetaminophen is simple. It's common, accessible, and sometimes useful for mild attacks. But the reason migraine specialists often move beyond it is just as important. Migraine usually requires a more specific strategy than ordinary headache pain. And that's where the next medication comes in, one of the most recognized migraine-specific drugs in America. Now we're moving into a completely different category. Unlike Tylenol, sumatriptan is a migraine-specific medication. It's part of a class called triptans, and it's used to treat a migraine attack after it starts, not to prevent future attacks. Major migraine references describe triptans as a very effective acute treatment for many people with migraine, and Mayo Clinic notes that sumatriptan is used for acute migraine in adults, not prevention. And that's exactly why doctors prescribe it. If a patient is having a real migraine attack, not just general head pain, but the pounding, disabling kind that can come with nausea, light sensitivity, sound sensitivity, and the need to stop everything, doctors often want something more targeted than a general pain reliever. Sumatriptan was designed for that kind of situation. Medical sources also note that it can help relieve not only the headache itself, but other migraine symptoms that often come with it. This is also one of the reasons sumatriptan became such a recognizable name in migraine treatment in the US. It represents a shift from headache medicine to migraine medicine, from something broad and general to something doctors may choose when they believe the problem is specifically migraine. And according to the American Migraine Foundation, triptans can be more effective for more moderate to severe attacks, or for patients who haven't responded well enough to standard analgesics. But there's another important reason doctors don't prescribe the same migraine medication to everyone. Sumatriptan isn't the right fit for every patient. The American Migraine Foundation notes that triptans may need to be avoided in some people, depending on other health factors and medications. And migraine organizations describe treatment plans as individualized rather than one-size-fits-all. So the reason doctors prescribe sumatriptan is simple. They want a medication that's aimed directly at stopping a migraine attack once it's underway. And once you understand that, you start to see why migraine treatment isn't really about finding one famous pill. It's about matching the right type of medication to the right type of patient, at the right moment. Now, this is where the list gets more interesting, because rizatriptan belongs to the same general family as sumatriptan, the triptans, but the reason doctors may prescribe it is not just because it's another option, it's because migraine treatment is rarely one size fits all. Like other triptans, rizatriptan is used to treat a migraine attack after it begins. It is not a preventive medication, and it is not meant to reduce how often future attacks happen. Its role is acute treatment, helping stop the attack that's already underway. So why would a doctor prescribe rizatriptan instead of another triptan? Because even within the same category, patients respond differently. Some people respond better to one triptan than another. Some tolerate one better. Some prefer a certain form or timing. And migraine organizations emphasize that treatment plans are often individualized based on symptoms, response, and contraindications, not just based on the name of the drug. And that's an important lesson in this whole video. A lot of people think that once you've heard the word triptan, you've basically heard the whole story. But that's not how doctors think about it. They're often trying to match the medication to the patient, not just the diagnosis. Rizatriptan is prescribed because doctors may want a migraine-specific acute medication, but with a different fit than another option in the same class. It's still part of the same broader strategy. Stop the attack early, use something targeted, and try to control the migraine before it escalates. American Migraine Resources describe acute treatment exactly that way, as rescue therapy meant to interrupt an attack while it's happening. And just like with the previous medication, this chapter also highlights something bigger. Migraine treatment isn't only about finding a famous name. It's about understanding that two medications can belong to the same family, do a similar job, and still be prescribed for different people for different reasons. And from here, the list starts moving into a newer generation of migraine treatments, medications that change the conversation in a very different way. Now we move into a newer generation of migraine treatment. Ubrogepant, also known by the brand name Ubrelvy, is prescribed because doctors may want an acute migraine medication that is specifically designed for migraine, but from a different class than the triptans. It is used to treat a migraine attack after it starts, not to prevent future attacks. Mayo Clinic describes Ubrogepant as a medicine that works in the brain to relieve migraine pain, and notes that it is not an ordinary pain reliever for general pain. And that's exactly why this medication changed the conversation. Up to this point, we've talked about familiar pain relievers, and then triptans, a class many people associate strongly with migraine. But Ubrogepant represents something different. It belongs to the Gepant category, a newer type of migraine treatment, and American Migraine Resources describe Gepants as one of the newer targeted options for acute migraine care. So why would a doctor prescribe Ubrogepant? Because some patients need an acute migraine treatment that fits differently into their overall medical picture. Migraine treatment in the US is individualized, and major migraine organizations emphasize that acute medications are meant to stop an attack while it's happening, but that the exact choice depends on the patient, symptoms, and treatment history. This is also one of the reasons Ubrogepant became a big name in recent years. It helped reinforce the idea that migraine treatment is evolving beyond the old model of just take a painkiller or even just take a triptan. Doctors may prescribe it because they want something targeted to migraine itself, but through a newer treatment pathway than the medications many patients already know by name. Mayo Clinic also notes that this medicine is usually used in people whose headaches are not helped or relieved by acetaminophen, aspirin, or other pain relievers. So the reason doctors prescribe Ubrogepant is not because it's just another pill on a long list. It's because migraine medicine has become more specialized, more targeted, and more tailored to the individual patient than most people realize. And from here, the list keeps moving deeper into that newer, more modern side of migraine treatment. Next is Rimegepant, better known to many people in the US as Nurtec ODT. Doctors prescribe this medication because it sits in a very interesting place in migraine treatment. It's part of the newer Gepant category, which means it's designed specifically for migraine, not for general pain, and not as a basic headache medicine. And that's one of the big reasons it gets attention. When doctors think a patient needs something more migraine specific, but they want an option from this newer targeted group of medications, Rimegepant often enters the conversation. American migraine organizations describe Gepants as part of the newer wave of migraine treatment, and Nurtec ODT is one of the names many patients now recognize. Another reason doctors may prescribe it is that migraine treatment is no longer just about picking the oldest or most familiar drug. It's about choosing a medication that fits the patient's overall pattern of attacks, treatment history, and how their migraines behave. So the reason Rimegepant gets prescribed is simple. It represents the newer, more targeted direction of migraine care in the US. And the next part of this list starts shifting from stopping migraine attacks to trying to prevent them from happening so often in the first place. Now the list makes an important shift. Topiramate, also known as Topamax, is commonly prescribed because doctors are no longer just trying to stop a migraine attack. They're trying to prevent future attacks from happening so often in the first place. American Migraine references describe topiramate as a commonly used anticonvulsant for migraine prevention, and Mayo Clinic notes that it is used to help prevent migraine headaches. And that's what makes this medication different from the ones we just covered. This is not a take it when the migraine starts type of drug. This is the kind of medication doctors may consider when migraines are becoming frequent enough, disruptive enough, or severe enough that prevention starts to matter more than simple rescue treatment. The American Headache Society and American Migraine Foundation both frame prevention as a major part of care when attacks are frequent or disabling. So the reason doctors prescribe topiramate is simple. They may want to reduce how often migraines happen, how intense they are, and how much a patient has to rely on as-needed medication. And once you get to this stage of the list, you start to see the bigger picture. Migraine treatment isn't just about stopping pain. Sometimes it's about changing the pattern of the disease itself. And the next medications keep pushing further into that preventive side of migraine care. Now here's where the list surprises a lot of people. Propranolol is commonly prescribed for migraine, even though most people know it as a blood pressure medication. That's because doctors may use it not to stop a migraine once it starts, but to help prevent migraines from happening so often in the first place. American Migraine references list propranolol among the beta blockers with strong evidence for migraine prevention, and Mayo Clinic notes that propranolol is also used for migraine headaches, and that's what makes this medication so important to understand. It shows that migraine treatment is not always about painkillers. Sometimes doctors prescribe a medication because they want to reduce frequency, severity, and overall migraine burden over time. Preventive treatment is often considered when attacks are frequent, long-lasting, or disruptive enough that rescue medication alone is no longer enough. So the reason doctors prescribe propranolol is simple. They may want to help change the pattern of migraine, not just react to the pain after it begins. And as this list continues, that preventive side of migraine care becomes even more obvious, because some of the most recognized names in migraine treatment are prescribed for reasons most people would never guess. Now, here's another medication that surprises a lot of people. Amitriptyline is commonly prescribed for migraine, even though most people don't think of it as a migraine drug first. Doctors may prescribe it because it's used as a preventive treatment, meaning the goal is not to stop one attack in the moment, but to help reduce how often migraines happen over time. Mayo Clinic and the American Migraine Foundation both list amitriptyline as a preventive option for migraine, and that's what makes it important in this list. It shows again that migraine treatment is not always about taking something during an attack. Sometimes doctors choose a medication because they want to change the bigger pattern: fewer attacks, less severity, and less reliance on rescue meds. The American Migraine Foundation specifically notes that amitriptyline is an older, lower-cost option that can effectively prevent episodic migraine, though it also comes with side effects doctors have to consider. So the reason doctors prescribe amitriptyline is simple. They may want a preventive medication that helps reduce migraine frequency over time, rather than just reacting to pain after it starts. And as the list keeps going, the names get even more recognizable, because some of the most famous migraine treatments in America are prescribed for very specific reasons. Now we get to one of the most recognizable names on this entire list, Botox. And yes, doctors really do prescribe Botox for migraine, not because it's a beauty treatment that somehow became trendy in headache medicine, but because in the US, it is used as a preventive treatment for chronic migraine. American Migraine Sources and Mayo Clinic both describe Botox as an approved option, mainly for people with 15 or more headache days per month, which is the chronic migraine category. And that's the key reason doctors prescribe it. This is not about stopping one attack in the moment. It's about helping reduce the frequency and severity of migraine over time, in patients whose headaches are happening a lot. American Migraine Foundation materials also describe Botox as something given on a repeated schedule in a healthcare setting, not as an at-home rescue medicine. So the reason doctors prescribe Botox is simple. They may want a preventive option for patients whose migraine pattern has become chronic, frequent, and hard to manage with acute treatment alone. And from here the list moves into some of the most modern migraine medications in the US, drugs designed even more specifically around the biology of migraine itself. Now we get to some of the most modern names in migraine treatment: Aimovig and Emgality. Doctors prescribe these because they are part of the newer anti-CGRP group, treatments designed specifically around the biology of migraine itself. American Migraine Resources describe anti-CGRP therapies as one of the biggest advances in migraine prevention in recent years, and Mayo Clinic lists Aimovig as a prescription medicine used to prevent migraine headaches. And that's the key reason these medications stand out. They are not general painkillers. They are not take it when your head starts hurting drugs. Doctors may prescribe them because the goal is prevention, reducing how often migraines happen over time, especially in patients who need something more targeted and migraine-specific. The American Headache Society has also described CGRP targeting therapies as a first-line option for migraine prevention. So the reason doctors prescribe Aimovig or Emgality is simple. They may want a treatment built specifically for migraine prevention, not just another medication borrowed from a different condition. And that says a lot about where migraine care is today. Because once you look at this full list, the real story becomes clear. Migraine treatment in the US. has moved far beyond ordinary headache medicine, and the biggest mistake is assuming all head pain should be treated the same way. So let's bring it all together. The biggest takeaway from this list is simple. Headache medicine and migraine medicine are not the same thing. A very popular medicine like Tylenol may be something people reach for first, but doctors often prescribe other medications when they believe the problem is truly migraine, especially when attacks are more severe, more frequent, or more disruptive. And as American migraine treatment has evolved, the options have expanded from general pain relief to triptans to preventives like Topamax, propranolol, amitriptyline, and Botox, all the way to newer CGRP targeting treatments like Aimovig and Emgality. And that's really the point of this video, not to tell you what to take, but to show you why doctors prescribe different medications for different migraine patients. Because once you understand that, you stop thinking of migraine as just a headache, and you start seeing it the way specialists do, as a neurological condition that often needs a much more specific strategy. If this video helped you understand migraine medications in a clearer way, give this video a like, and if you want more clear, science-based videos about migraines, headaches, and chronic pain, subscribe to Headache Relief Lab. And let me know in the comments, which of these migraine medications had you heard of before, and which one surprised you the most? This video is for educational purposes only, and is not a substitute for medical advice, diagnosis, or treatment. Thanks for watching, take care, and I'll see you in the next video.